Welcome back to Coursera. This is Lecture 8. Now we're going to begin to get very specific about muscles, groups of muscles, individual muscles, and how they act at specific joints, moving a body part in a certain direction, their innervation, and their blood supply. And our conversation is going to start with actions that occur at the more proximal joints of the upper limb, and then move progressively distally down the arm, the forearm, and eventually into the hand. So first off, let's start going from proximal to distal, starting with the movements that are possible at the pectoral girdle. So the pectoral girdle, as we know, consists of the clavicle or collarbone and the scapula or shoulder blade, which we previously described. And as we've already said, the clavicle is the only actual synovial joint articulation between the entire upper limb and the axial or trunk skeleton. And that joint is at the so-called sternoclavicular joint, which is in a synovial joint where the medial end of the clavicle is articulating with kind of the upper lateral end of the manubrium of the sternum. Then, as we know, the pectoral girdle is formed by two bones, the clavicle on the anterior side and the scapula on the posterior chest wall. And the clavicle and the scapula articulate together at something called the acromioclavicular joint. The acromion is really the lateral expanded portion of the spine of the scapula. So this joint indirectly links the scapula with the trunk skeleton, but other than that articulation, the scapula has no other specific synovial joint articulation with any other bone, basically, of the axillary wall. So, and as we will see, certainly the head of the humerus is situated in an articulation with the glenoid fossa of the scapula, but we'll talk about those specific movements in a subsequent lecture. So the first part of our conversation is going to deal with the actual movements that the pectoral girdle can undergo and the series of muscles that perform those movements. So let's look at a kind of a schematic diagram of that, because what we're going to see is that the entire pectoral girdle, mainly the scapula, although the clavicle certainly goes along for the ride, can be moved really in three different directions. When we elevate or depress the scapula and the clavicle along with it, in essence, we are shrugging our shoulders or depressing our shoulder. And since elevation is an action performed against gravity, it's going to require the more numerous muscles, whereas depression will be certainly favored and enhanced by gravity, requiring muscles that are not quite as strong to perform those actions. So we need a series of muscles that will perform these antagonistic movements, moving the shoulder girdle, pectoral girdle superiorly, and then allowing it to return to the anatomic position. Then we have an additional set of muscles that have the ability to pull the entire pectoral girdle in the direction of my arrow around the circumference of the chest wall. And these actions are, basically they have some synonyms. Number one, they're commonly referred to by anatomists as protraction and retraction, but as you will see in our digital atlas, they're also referred to as scapular adduction and scapular abduction. So we'll see basically how these actions work as well going forward. But suffice it to say, these are moving the entire pectoral girdle, mainly the scapula again, by rotating it along with the clavicle horizontally along or about the circumference of the chest wall. So we will need some muscles to protract or abduct the shoulder girdle by moving it anteriorly, this being the anterior direction, or a corresponding series of antagonist muscles that will return the scapula, which is the major bone being moved by this action, along with the clavicle back to the anatomic position. Then lastly, we will need an additional series of muscles that will upwardly or laterally rotate the scapula or downwardly or medially rotate the scapula. And we can define this axis kind of about an axis of rotation that's occurring largely through the posterior aspect of the scapula. And the axis of rotation is perpendicular to that, such that, in essence, we can kind of define this movement by moving the acromion process. If the acromion process, and therefore the clavicle with it, is upwardly rotated, that's going to aid movements of the humerus in abduction of the arm. And then to return the scapula to the anatomic position, we will medially rotate the acromion process back to the anatomic position. So we're going to look at these pairs of actions individually and the muscles that certainly are involved in performing them. So first off, let's look at our next slide, which will start that process going forward. So first off, here's a chart, and we're going to refer back and forth to this chart somewhat a lot, because this will give us a basis of comparison of the specific names of the muscles that are performing actions. And you can see we've grouped them in pairs. We have muscles which will elevate and depress the scapula, muscles which will protract and retract the scapula, and muscles, as we indicated, will upwardly or laterally rotate or downwardly or medially rotate the scapula and therefore the pectoral girdle when we ab and adduct our arm at the shoulder. All right, so let's identify the muscles. So note that, and we'll see pictures of these, that the elevators, probably the best elevator, is the middle one on this list, and this is the upper fibers of a very broad muscle that dominates the superior and posterior aspect of the back, known as the trapezius, named because it's kind of trapezoid shaped if we draw lines around the two muscles bilaterally. Certainly, as the name implies, this action is assisted by the levator scapulae. Boy, that's easy to remember because it simply tells you exactly what that muscle does. And lastly, there will be a pair of rhomboid-shaped muscles, major and minor, which will assist in this action as well. Then depression, largely assisted by gravity, so we don't need as powerful muscles. But here we're going to find the lower part of the trapezius acting, a very broad lower superficial back muscle called the latissimus dorsi also helping out, as well as some fibers on the anterior chest wall of the pectoralis minor and the pectoralis major. Now, remember back when we organized the upper limb blood supply and we talked about the gradient of innervation across the brachial plexus. And we described that gradient basically as meaning that nerve fibers that arose from the superior part of the plexus, generally containing C5 or C6 fibers, were largely going to be involved in the innervation of proximal muscles in the upper limb. And certainly, one of the most proximal series of joints in the upper limb that are going to be acted upon by those muscles will be the shoulder girdle. So again, note the theme of this, although some variations are certainly evident in this chart. You can see that the major source of innervation of muscles that are moving the pectoral girdle are largely proximal in origin, C5 and C6, and to a lesser degree C7. So all of these named branches, scapular, thoracodorsal, medial, pectoral, and so on, are actually branches of the brachial plexus. The outlier here, and kind of interesting in and of itself, is the spinal accessory nerve. In this case, innervating all parts of the trapezius muscle. The accessory nerve is actually a cranial nerve, but it's kind of a misplaced name for a cranial nerve because the accessory nerve actually arises from the upper 4 or 5 cervical spinal cord segments. So it's not really a cranial nerve in terms of its origin. It becomes named as a cranial nerve because it actually exits through a hole in the skull, which is another criterion for cranial nerve. But aside from that fact, it is really a major innervator of a muscle that is acting on the upper limb, the trapezius. So we're going to look through basically these series of muscles and their antagonistic actions, starting with the muscles that elevate and depress the scapula as listed on this chart. But we'll see this chart again as we move to the other actions that the pectoral girdle is involved in. So let's start with elevation and depression. because we certainly said that literally is moving the pectoral girdle up or down, superiorly or inferiorly, on the posterior chest wall for the scapula, and moving the clavicle along with it, basically on the anterior chest wall. So what are the major players that are involved in this action? Well, again, we've illustrated the major ones. They are going to be levator scapulae and trapezius on the elevation side, and on the depression side, gravity, assisted by the lower fibers of the trapezius and latissimus dorsi on the back side, and by the two pectoral muscles on the anterior chest wall. So let's look at them in detail. First off, we can see where we're going with this, and if we look basically at a specimen or a cadaver or basically an upright person without their shirt on, we would gain the impression underneath skin and fascia of the muscles that are on the posterior chest wall in a superficial position that are located in an area where they can act on the pectoral girdle. And certainly you're seeing the broad outline basically of some of the fibers that make up the trapezius muscles, trapezoid in shape if we add the two muscles together. And we can also see hints of other muscles that are acting on the pectoral girdle as well. So the view on the right is the Netter Atlas depiction of the muscles that are mainly acting to in this case, elevate the scapula. And one of the major muscles, which is certainly in a position to elevate the scapula and therefore the pectoral girdle, are these upper fibers of the trapezius. Upper fibers of the trapezius. And that's a superficial view of them, and through the beauty of Netter, if you remove the trapezius, and that exposure is shown on the other side, then what this reveals are the fibers right there of the levator scapulae muscle, putting it basically in a position to attach near the superior angle of the scapula as well as to cervical vertebrae, and certainly in a position to elevate the scapula along with the upper fibers of the trapezius when these two muscles contract. And lastly, although they are weak elevators, elevation can also be assisted by a pair of rhomboid muscles that arise from the spinous processes of vertebrae in the midline and move out to attach to parts of the vertebral or medial border of the scapula as shown here. So those are certainly the three major muscles, four total actually, that are going to act to elevate the scapula and therefore the pectoral girdle. So here they are. Basically, here are the upper fibers of the trapezius. There they are. And we've identified the levator scapulae, and the rhomboids have now been specifically identified. They are the rhomboid minor, which corresponds to about 1/5 of the rhomboid complex, and the rhomboid major, which constitutes the more inferior fibers that have similar actions. And again, here specifically we see identified the superior fibers of the trapezius. Note that the trapezius, being a very broad muscle, has fibers that are also forming part of the middle fibers of the trapezius and the inferior fibers of the trapezius, and because their fiber directions are going literally in different directions, the middle fibers of the trapezius are going to have different actions than the inferior fibers versus the superior fibers. So we're just looking at an isolated view of the extent of both trapezius muscles as they have attachments to the base of the skull, to cervical vertebrae through a nuchal ligament, through spinous processes, basically all the way down to about T12, and the muscles basically converge to attach broadly across the upper portion of the scapular spine, including all the way out to the acromion process. Then, looking individually, here are the individual fascicles of the levator scapulae. They are rising from the upper couple of cervical vertebrae and descending inferiorly down to attach near the area of what is called the superior angle of the scapula, and certainly putting this muscle in a very good position to act as a scapular and therefore a pectoral girdle elevator. Okay, then here are the rhomboids. Again, you can see the rhomboid minor, and then obviously the components of the rhomboid major. So this muscles, because of the obliquity of the fibers, as we will see, will not only be relatively weak elevators, they're also going to be in a position, as we will see, to retract or pull the medial border of the scapula back into the anatomic position. And we'll visit that basically during our next series of pectoral girdle actions. Now let's consult the digital atlas to give us an active view of the muscles which are certainly serving, as we indicated, to elevate the scapula. And the first one you're seeing from a posterior view basically are mainly the superior fibers of the trapezius, doing a very good job of pulling up on the spine in the acromion process of the scapula. And even though I can't isolate through my depiction here just the upper fibers, certainly it's those superior fibers of the trapezius that are majorly playing a role in scapular elevation. But then if we rotate our friend around here onto the anterior side, we can see the contribution made by the fibers of the levator scapulae. And certainly that's the illustration is here. If I sweep around here, and then that'll obviously give us a sense that that muscle too is playing a role in this process. What we can't see in this particular image are the fibers of either of the rhomboid muscles because they're kind of hidden by the posterior chest wall. Now let's look at the antagonist muscles to our scapular elevators. And they, again, as we've already indicated, are a pair of pectoralis muscles on the anterior chest wall and the inferior or lower fibers of the trapezius and the latissimus dorsi. So let's see those. So now we're talking about the inferior fibers of the trapezius, obviously in a very good position to depress the scapula, assisted by gravity. And even though it's not obvious from the picture, the latissimus dorsi will also aid in this process, not by having a direct attachment to the scapula, but by literally pulling down on the humerus, and as the humerus goes, so goes basically the pectoral girdle. So that obviously will be an action performed by that muscle, among others. Then, again, we see the inferior fibers of the trapezius now in a very good position to pull down or inferiorly on the spine of the scapula. And we also see a better view now of the latissimus dorsi. Note that its major attachment is really to the shaft of the humerus, where it's going to have a variety of actions, as we will see at the glenohumeral or shoulder joint. And most anatomists basically give the superior fibers of the latissimus an attachment to the inferior angle of the scapula. In the cadaver, that's actually hard to demonstrate, but if it exists, it certainly puts the latissimus in an even better position to pull down on the pectoral girdle. But really, the major way that this muscle acts as a depressor of the pectoral girdle is by pulling down on the shaft of the humerus through this broad muscle which attaches to the superficial aspect of the inferior and posterior aspect of the back. Then on the anterior side, certainly using the same analogy, more largely the inferior fibers of the sternocostal head of the pectoralis major can do the same thing. They can pull down on the humerus, and by virtue of that, pull down on the pectoral girdle. Certainly, this could be assisted by the clavicular head of the pectoralis major, which is attaching to the medial aspect of the clavicle. And certainly, you can't see it well here, but we'll see this basically in a subsequent conversation. There's an outline of the pectoralis minor. It's situated deep to the pectoralis major, and it has a very precise attachment to the coracoid process of the scapula, as well to the chest wall, putting it really in a very good position to pull down specifically on the scapula from its anterior side. Now let's refer back to our digital atlas, and now basically we see the inferior fibers of the trapezius playing a major role in depression of the pectoral girdle from the anterior side. And if we rotate this around to from the posterior side, if we rotate this around to the anterior side, now you can see the individual depressing action of the pectoralis minor. pulling down on the coracoid process of the scapula, and certainly playing a role in depression of the pectoral girdle. Note that even though we didn't mention it, to a small degree, the fibers of the serratus anterior, which is situated back here on the lateral chest wall, are adequately positioned to have a major role on the scapula, major action on the scapula, and we'll investigate those in our next lecture.